Great. I think we can at least get started with the introduction, if that's okay. I don't want to cut into Dr. Ty's time too much. So welcome everybody. This is our first event or faculty speaker event after doing a new cycle of editors. And I apologize for background noise on my end. I'm at the airport right now, but I'll try to be quick about this. So we are the Michigan Journal of Medicine. We're really excited that everybody is here. I know at least all the editors are going to be here, and hopefully some reviewers are here too to listen to Dr. Tai speak. So just some introductions. First of all, my name is Anuj Patel. I'm a third-year medical student. I use he/him pronouns, and I'm one of the co-editors-in-chief. And I'll let my other co-editor-in-chief, Sammy, introduce herself.
Hi, I'm Sammy. I'm also a third year. I'm currently taking a year away to do a Master of Science in Clinical Research, and Anuj will actually be doing the same with me. And I use the pronoun she, her, hers, and I'm also one of the two co-editors-in-chief.
And then these are our lead editors. So this is our core team that allows the journal to function well and smoothly. So I'll let everybody kind of introduce themselves really briefly. We can go in the order from left to right if Rachel is here, if she wants to introduce herself. Rachel, are you with us?
I'm not seeing her having like audio capabilities on this.
Okay, that's okay. I'll introduce Rachel. So Rachel Bergman is our fundraising editor. So she is really the core of raising funds for us to be able to publish our journal on a yearly basis. And I'll pass it off. And Rachel uses she/her pronouns. I'll pass it off to Ramona.
Hi everyone, my name is Ramona. I'm also an M3. I'm also currently taking a research year before I start my branches, and I'm the outreach editor for the MJM. I'm excited to be working with everyone this year.
Hi, I'm Cameron. I'm an M2. I'm the managing editor, so I just manage correspondence between reviewers, editors, and then our awesome team. Thanks.
Hi, I'm Renee. I'm technology editor. I'm a fifth year MSTP student. I'm technology editor, so I take care of the technological aspects of the journal, maintaining the website and so forth.
All right, and then last, I'm Morgan Penny. I'm an MD PhD student now in my on the other side of the PhD in my M2 year. I'm the education editor this year. So in terms of the speaker series and also the academic communications course with our editors-in-chief, these are sort of the things that I focus on. So and for the academic communications course, it's the Michigan Journal of Medicine half of that.
Awesome. And then, on top of our lead editors, we have this awesome team of, editors as well who will function to help review articles as they come in. So Peter Delaney, Ahmad, Cecilia, Jeremy, Andrew Nebel, Eric Olson, Zoe Chopra are all of our, our wonderful team of editors. So, as we kind of talked about this and introduced ourselves, this is really the structure of the Michigan Journal of Medicine. 2 editors-in-chief, myself and Sammy, the 5 lead editors Joe heard from, and then a total team of 12 editors. And we really have a really big team of over 50 reviewers, and we're hoping to grow that as well this year. So our mission for this year with the Michigan Journal of Medicine, and it's the same as the past years too, with some slight differences, is we really want to ensure the publication of student research for the advancement of evidence-based medicine. So we're really a student-centered journal. We require that any submissions that come to our journal have at least one student author that's associated with the University of Michigan. So we're really focused on bringing student voices to the forefront of research. And we really, in this process, want to develop future physician scientists with a good understanding of the editorial process. So our review process is based very closely off of what happens in, higher tier journals, and that's during its inception of Michigan Journal of Medicine. That's how our review process was created. So we really want to give students and future physician scientists a good understanding of that. So here's just a little bit of a schematic, just so everybody's on the same page about what our review process is. I'll summarize it simply by saying, when we get a submission through our submission platform, that article is assigned by our managing editor, Cameron, an initial review team, which consists of 4 reviewers and 1 editor. And that initial review team is really critical. They have a meeting together. They'll discuss the pros and cons, what the limitations are of the study, whether it's a good fit for our journal. And the editor of that team will compile a document on what exactly they discussed and what their proposed kind of decision would be on that article. And I want to point out at this point that it is our policy to never outright reject an article. Any article that comes our way, we are willing to work with the authors to get it up to a publication standard that is, up to the level of a publishable paper. So from there, the editor will suggest a decision. It'll come back to either Sammy or myself, one of the co-editors in chief. We'll come up with a final decision, and then we'll, relay that back to the authors. Most of the time, it will be requiring some revisions, and then it will just go kind of back and forth between editors in chief and the authors, just to get the paper up to a quality that is publishable. So that's kind of our review process, and that's how editors and reviewers kind of play into that. Sammy, do you want to take this slide?
Yeah, so I'm just going to update you on where we are at for the journal. So the 2020 issue ended up being delayed because we were unable to raise enough funds to publish it. And as such, that also pushed the 2021 issue back as well. So the issues from our journal are typically published in the spring. As a result, the issue that is currently in process with Michigan Publishing Services is from 2020. And this is currently in the copy editing phase, basically to make sure all the nuts and bolts and pieces are okay. And then we move to the typesetting phase, which makes everything look pretty. So that should hopefully be done in the next couple of months. And then we anticipate, based on the funds we were able to raise on Giving Blue Day a couple of months ago, that we'll be able to publish the 2021 issue within this year. That'll be about 6 to 7 months behind schedule, but they'll hopefully allow the next editors in chief to be able to then publish the 2022 issue on schedule and without further difficulties.
Awesome. And here, I just took a screenshot of our website. You can visit our website if you just Google Michigan Journal of Medicine. We have all our volumes on the website if you want to take a look at what past issues have been like. And here, it's just a snapshot of one of our volumes. And I really wanted to put this in here just to kind of highlight the variety of article submissions that we accept and that we will publish. We get a lot of perspective pieces, which is great if students are just interested in publishing a perspective or an opinion on something that they've seen in the clinical world. We publish case reports, original research. In the past, we published innovation pieces as well. So it's quite the range, and we'll accept quite a few number of submission types and kind of form it into one of these categories. Sammy, you want to take this one?
Mm-hmm. So Morgan is our wonderful lead education editor. So she is responsible for helping coordinate the different speakers, like having Dr. Tai this evening speak with us. We'll have a speaker every other month or every month, depending on how Morgan would like to schedule it. And we'll also have journal clubs and trying to figure out the exact schedule of when this will take place. But those will be led by students. So we hope that for editors, you're required to come to these events as like part of being an editor, but also for reviewers, we hope that you come as much as you possibly can so you can continue to learn about research and how to produce effective research, which is something that we don't always get enough of throughout our medical school education. I can also speak to this a little bit. So when Anuj and I were talking as we came into these roles, we had three kind of major goals that we wanted to focus on. And these aren't in any particular order. One of them involves indexing within PubMed via PMC. And this would allow us to have a broader reach of all the different articles that the student authors submit. It would allow students to increase their reach to other people in part of different areas of the globe, and also kind of heighten the level, so to speak, of the journal. The process of this is quite extensive. We have to develop all sorts of policies, and Renee, our technology editor, is helping us work with that. And Peter Delaney, who is one of our current editors, was also involved in helping develop those policies. So that is something that we hope to submit an application for in early 2022. There's a lot of technical reasons why we are delaying the application until that time, but once things are all put together, we hopefully will have it done by then. The other thing that we're really focusing on is having some sustainability for the financial support of the journal. So it costs roughly $5,000 to publish each and every single issue of the journal. And all aspects of the journal are run by students. So we're trying to raise $5,000 while we're doing our sub-Is, and that's a lot of work. Rachel Bergman is our fundraising editor for this next year, and she'll be instrumental in helping coordinate the fundraising efforts. And as part of being an editor, you'll be involved in that process as well, and strongly encourage if you're a reviewer. But this is in order for future years of the journal to keep happening, right? We don't want it to end with us and all of us working together. We'll really ensure the success not only of the current year, but also years to come. And the third thing that we really want to work on as well is increasing the number of submissions to the journal. And this involves expanding to surrounding medical schools within the state of Michigan, as well as with other health profession schools that are associated with the University of Michigan. Submissions can be taken in at any time. There's no call for submissions that is specific to certain parts of the year. If you have an article and you want to submit it for review to eventually get published, please do so at any point in time, and encourage your friends to do so as well.
Awesome. Yeah, that's all we really wanted to say. It was just a quick intro to the journal. Now that we have this new editorial team, Sammy and I are really excited for this upcoming year. So if you have any questions, I put our individual emails right there, but you can also reach us at editor-in-chief, visit.mjm@umish.edu, I believe. So we can put that in an email communication as well. But otherwise, I don't want to cut into our wonderful faculty speaker presentation, so I'll hand it off to Dr. Tai.
Great. Well, thanks so much for the invitation to speak, and obviously for taking time out of your evening to be here. So I guess it helped me a little bit for me to know where we all are in terms of your experience reviewing. I have the chat on, and can you just put an X in if you've never reviewed a paper before?
I'm just going to jump in and request that, if possible, you guys turn your cameras on just so we can interact with Dr. Tai. And just so you all know, this session is being recorded so that editors who aren't present can watch it later.
Okay, so we have at least a few people who've never reviewed before. And I'm going to ask a different question, which is, if you've ever submitted a manuscript for publication, can you put that into the chat just as another X? All right. So a lot of people who have submitted papers for publication. And so what I will say, for those of you who haven't, is that the first time, maybe it's always the case for us of our career, when you send a paper in for publication, it represents so much of your effort, right? And it really is your baby, and you've invested so much into it that the review process is so important, not just to make the paper hopefully better, but also to understand how much emotional investment goes into these things. And so we talk about the review process. I think it's really important to kind of be mindful of the authors and where they're coming from. And your job is to help them, make a paper better, not just to shoot down their paper for all the things that are wrong with it. Okay. I didn't prepare any slides, but I'll share some of the stuff that Morgan shared to me that was sent to you. And maybe I'll just start with that review on systematic reviewing that I thought was sort of a nice way to start. Can you see my screen? Okay, so so if you haven't read this, I think it's worth a quick look. I think all of you who review papers, it's very helpful to have kind of your process for how to do this. Of course, oh, and the other thing I say is feel free to jump in. So just feel free to ask questions. It's a small group, or type something in chat and we can just kind of hit it as we go. Okay, so this is not meant to be super formal. But whatever your process is, try to be consistent, because I think that's important to be sure that you're equitable and consistent from paper to paper that you see. And so they make one point here. What's your job, right? So your job is, first of all, does this manuscript merit publication? And second is to be helpful, be constructive, right? So it's not just to say, oh, this is awful, but really to talk about how we can make this paper better. And I also want to kind of bring this overarching rule, which is really the golden rule. So you treat authors as you would want to be treated yourself as an author too. So that's really important. Then the related thing I would point out is that no study is perfect. All right, I think sometimes a temptation, especially as a new reviewer, when I first started reviewing papers, I felt like the temptation was to kind of like show off how smart I was and to kind of point out all the things I was wrong and look how smart I found all the flaws in your paper. But really, it's much more than that. And I think you should really come at it thinking, okay, nothing is perfect, but does this paper fundamentally answer the question that the authors have set out to the authors have asked at the beginning? Okay, and so at the outset, I think a very helpful, what I do personally is I just quickly skim the abstract in introduction, and I really have just a few questions there. So first of all, do I have the right expertise to review this manuscript? And I think for MJM, probably it's maybe not as critical in the sense because you handle so many different areas in your journal that maybe you're not going to have like a content expert in liver cancer, as you might in this very specialized journal. But you should at least feel like you're comfortable reading this area, and if it's really outside of your scope, then I think you should feel free to tell the editors, I'm really not comfortable with reviewing this. Then the second question you want to ask when you look at the abstract and the introduction is, what's the premise of the study, and what question are authors really trying to answer? Okay, what are they trying to do here? And then after you've settled that question, what are they trying to do? Then is this an important question to study? All right. Is this important? Is it relevant? And has it already been addressed by others? And this is sort of this third part here that I've highlighted here. So what are they trying to study? Does this address a topic that'll be of interest? And is this kind of quote unquote important? Okay. Now, I do want to stress that I think sometimes we fall in the trap of saying, oh, we only want to take original or novel things. And I want to be careful about that trap, because while it's always interesting to find something new, I think probably many of you are aware of the sort of public positive kind of results bias. All right. So it's really clear when you read papers that papers that find something positive are much more likely to be published, whether or not they're true. And also recognize that a really important goal of science is also to replicate things or to extend findings to other populations, for example. So it might be that whatever you're reading has already been done, but maybe not in this population. Or maybe it's really only been done once, and what you're reading is really an important step at replicating or reproducing what's already been found. Or sometimes the finding is truly negative, and that's also important too. So negative studies are also important if they've been well done. All right, so they're internally valid, they've designed the study correctly, and it's negative. People should know that, so that someone else doesn't go trying, to do something that has already failed. So I think that's an important thing to keep in mind. Okay. So usually what I do then is that I skim the abstract, skim the intro, I kind of know what they're trying to do. And then I have this lens in mind as I read the rest of the paper, because what I'm then, as a reviewer, I feel like my job is to ask, have the authors really convinced me that their conclusions are valid. Okay, which leads to, I think, another point that I'd like to make, which is that I think sometimes the temptation is for the reviewer to reimagine what they think the paper should be, and I should caution you not to do that. You should really approach it as what are the authors trying to say? What paper are they trying to show me? And at the end of the day, do I fundamentally believe what they're telling me? Okay, but it's sometimes we're tempted to say, oh, you should totally redo this in a different way, but that's no longer their paper anymore. That's someone else's paper. That's your paper. Okay, so keep that in mind too. Okay, so after I've read the intro, the abstract, I kind of know what they're trying to do. I will then usually kind of do a quick dip into the literature to understand, kind of put it in context. And this gets at, is this novel, is it interesting, or how does it fit into the literature? And I suspect that for a lot of the things that you're going to review for MJM, you're not necessarily going to be a content expert in that thing, right? So whereas I can pick up a paper in whatever my virus is and I know where it sits, you probably will have to do a little bit of digging, okay? To kind of put in a context. And secondly, I think sometimes you'll run into the paper where the authors either are unaware of the literature, or sometimes maybe they're trying to kind of hide that this other stuff has been done so that to make their paper seem more original. And so it is worth spending a few minutes in PubMed to kind of search and see what's been done. Okay. All right. So at that point, once I know the context, the premise, what they're trying to ask, then I think I go right to the methods. All right. So the methods is really, I think, the meat of the study in terms of assessing its internal validity. So you want to know what's a basic study design. So for a lot of the papers that you might see, for example, it might be a retrospective case control paper, right? I'm sure you see a lot of those at MJM. Or is it a prospective cohort study? Probably less common. Or is it a prospective randomized controlled trial? Obviously, probably also not that common. Or is it a survey? So you'll see all different kinds of methodologies. But I think you want to understand what's the basic methodology, what's the study population, right? And how are they sampling from that population to get their study sample? So for example, let's say your paper wants to ask something about medical school education. And to do that, they are sampling deans of medical schools by emailing them a survey, right? And so that's kind of the basic study design, and you really need to understand exactly how they did that. So once I kind of have a handle on, okay, how do they do that? Then the question is it internally valid? And so I assume you have talked about this in different ways in the medical school, but maybe not. And so maybe I'll stop here and ask, how comfortable are you all in sort of assessing kind of common biases in studies? Comfortable? Not comfortable? In the middle? Not sure?
I'd say in the middle.
In the middle. Okay. And I think the paper that Morgan and I picked out really kind of highlights several of these, and we'll talk about it. And Alicia makes a point where you don't get a lot of practice. You've heard about them probably academically, but probably haven't done this in a real world. Okay, so I think as we go through the paper that we picked out, we can go through some specific examples of different biases and expand on that. So I won't talk about it too much right now, but we'll go into that as we talk about the paper. So I think I read the methods with the different possible biases in mind, because some of them will jump out at you when you read how they did the study. And similarly, if this were a basic science paper, there are going to be sort of these systematic biases that may come out in terms of how experiments were done. And then I think especially, where I think there can be a lot of discomfort is, are the statistical analyses appropriate? And I think sometimes that's where people do have some misgivings about am I competent to analyze statistics. I'll point out one or two things I think are commonly trip people up, just to point out. And again, this comes up in this paper as well. So then, once I've sort of thought about internal validity and sort of thought to myself, okay, And I understand that MJM is a journal where you don't reject anything, but for other journals, we certainly would, right? And so I certainly would ask at this point, is there some fatal flaw of the internal validity where it's so flawed that they can't easily fix this in any reasonable amount of time and effort? Then I might just probably say this is going to be rejection at this point. Or is it something where there are flaws, but it probably can be addressed or at least acknowledged in the discussion and when it can be pointed out. And then I think about, okay, what's the external validity of the study? Meaning, how generalizable are these results? Is this something where we can apply this to all patients with this condition, or are there going to be some kind of important caveats to think about? Okay, so I've kind of gone through the methods, thought about all these things, and then finally I hit the results and the figures, okay? And then again, kind of coming back to this initial point where your job is to assess the author's claims. And so do the data support the statements and claims made in the paper, all right? And so do the data really say what the authors are saying the data say? And so you had to look at the raw data yourself, or at least the figures, and ask, okay, is this consistent with what the authors are saying? Are there inconsistencies? And that's okay. Sometimes the data aren't always perfect, and that's all right. But if there are inconsistencies, what does that mean for the author's hypotheses, and do they come around to pointing that out? And if they don't, maybe that's something that they should be doing. You should also be looking at whether or not the data and legends are clearly presented. If you were to look at the legends, look at the data, is it easily understandable? Is it confusing? Those are things I think are I think self-explanatory. And I think a more subtle point that I think we don't do enough in science is that I think there's a lot of confirmation bias in science. And what I mean by that is you have a hypothesis, you find some positive piece of data, and then the rest of the figures kind of are geared at confirming that piece of data, all right, rather than testing alternative hypotheses. And so I'm not sure that you'll get these kinds of papers at MJM, but I think really, really great papers are ones that systematically ask, well, what are alternative explanations for what I'm seeing here? And am I ruling them out one by one? Am I rigorously testing those one by one? Okay, so am I trying to actively refute my hypothesis? And so I acknowledge that that's not done as often as it should. There shouldn't be a reason for you to reject a paper, but look out for it. And then finally, we get to the discussion, and there's a lot of stylistic variation in this, but I agree with what they say in this paper here, that the discussion shouldn't be just a rehashing of all the results, because that's kind of redundant. Okay, so from a stylistic standpoint, the authors shouldn't use this as a way of just saying again what they said in the results. It really should be, okay, putting the results into perspective into the literature, what's been done already, how does this add to literature, or maybe why are these results different from what other people have found in other similar studies? Okay, so I think that's a really important component of the discussion. In addition, they point out here that in a good manuscript, the authors will try to explain things that are unexpected. I think that's important too. I mentioned earlier that sometimes the data don't neatly fit your hypothesis. And so why is that? And I think it's worth, a discussion of why that would be. And then finally, which is really important, every good paper should talk about limitations. As I mentioned before, there's no perfect study, right? And so the authors should come clean and say, look, this is limited because it's a retrospective single center study. The sample size is relatively small. We were not able to follow everyone up. There was some dropout. And so, I think those are things that are important to acknowledge. It doesn't invalidate what they found necessarily, but I think it allows a reader to put the findings into perspective. Okay, so I think these components are really important for a good discussion. And then finally, I think in terms of one thing that is easy for us to kind of skim over are the references. All right. I do think it's important to look at the references, not that you had to spot check every single one, but if the authors are really leaning on this reference as a really important part of their case, okay, or their premise, I do think it's worth checking the reference out. Does it really say what the authors claim the reference is saying? And you would be shocked to find, maybe not shocked, you'd be shocked to find how often you look at a reference and it says nothing related to what the authors say the reference is saying. So I do think it's sometimes worth spot checking some references, because I find that's often a problem, is kind of sloppy citations. And so I want to stop here and sort of let people kind of chime in and ask any questions or comments or things I missed.
How long does it take you to typically review a paper?
Yeah, that's a great question. So it obviously depends on how familiar you are with the field, right? And it obviously depends on how long the paper is. But I generally will not try to review the paper in one sitting. I think they mentioned this in this, everyone's a different style, but I generally don't try to write the review on the same day that I read it. So I will generally skim the paper over, and kind of let it kind of percolate in my brain and sort of come back to it in a little bit. So I often will read it, skim it, kind of form my initial impressions, but not really form any hard and fast judgments. So I come back to it. And I often find that gives me a little bit of time to internally process. And when I come back to it, then it's easier for me to formulate what I think. And so it generally will take me somewhere, it's almost paradoxical that a really terrible paper is easy to review because you can very quickly sort of dispense with it. And a really good paper is, I think, easy too. It's has the papers that really are pretty good, but really need work. And I think those are the ones I spend the most time on because I really want to think about what am I going to tell the authors in terms of where I think that it needs work and to explain it in a way that's clear. But I'll say it might take me anywhere from 1 to 4 hours to review a paper, depending on its length, if that maybe that helps. Okay. But yeah, I can't understate, especially for MJM, how important you are as reviewers. By and large, people submitting to MJM are relatively new to writing papers, and as you said, much of this, the whole one, I would imagine that one of the goals of MJM is really to help people get better at this, not just from the authoring side, but also from the editorial side and the reviewing side. So I would really think of this as a service, to the community. Okay. Well, yeah, go ahead.
Sorry to interrupt. We had one additional
Yeah.
from the chat.
Yeah.
So a question from a while back in your talk. Cecilia is wondering what you think about.
Oh yeah.
Decide if the manuscript is important.
Yeah, good. Yeah, it's a good question. So is a manuscript important? And I think important is really all in the eye of the beholder, of course, right? And so, for example, maybe this is important because it's a new technique. Maybe it's a new way of doing something, and so it's not necessarily like we discovered some important new drug to cure cancer, but we found a new way of doing something that's a really useful technical advance. And so there might be a technical advance, or really might be a discovery about an association between this exposure and this outcome that's important. Or maybe it helps resolve a controversy. Maybe there's a controversy in the field where the paper's on one side and the paper's on another side, and this is another piece of evidence that leans the field one way or another, and that can be important too. And as I alluded to earlier, maybe it's not necessarily original, but it's important because maybe it extends a finding to make it more generalizable, right? So maybe there was a paper from Johns Hopkins and their population of people with this disease, and you're extending this to a Michigan population, and maybe the sample is a little bit different in certain key ways. Maybe there are more women, maybe there are more minorities, maybe there's something that makes it different that extends that original finding, but still that would still be important. Okay, so I think it's all in the eye of the beholder. I do try as a reviewer to really be charitable and really think about, I really try to be generous in thinking of, is this somehow a contribution to the field that someone's going to find useful in some way? And I think oftentimes you can talk yourself into that. Okay, so the next question is, and I hope that answered that question, but feel free to type another question, Cecilia, if that wasn't clear. Okay, great. And then Jeremy asks, why, what I might, when I recommend that paper get rejected. And so there are several reasons. One is that maybe I really can't find something interesting about the paper. Maybe it really is something where it is the 10th paper to do this thing, to find the same result using a very similar methodology and sample. And so maybe it really is not that interesting for the journal that I'm reviewing for. And so some of it too is also the fit with the journal. I didn't mention that, but sometimes I'm reviewing for a journal that is going to be much more selective about the papers they accept. And so sometimes I do sort of calibrate that recommendation based on the journal. Sometimes it is because, as I mentioned earlier, the internal validity is so fatally flawed that no amount of kind of revising the discussion or maybe getting a little more data will fundamentally change the fact that I just don't believe that what they found is what they're claiming is supported by the data. And I think, again, this paper we'll talk about arguably might fall in this camp, but we'll talk about that. And then, finally, maybe the paper is pretty good, but there's so many things that I think they need to do that it's not realistic for authors to be able to revise it, at least in the time frame that they would have. So many journals would say, many journals advise that, because what we don't want to do is you don't give the authors 50 things to do that will take them a year to revise and resubmit, and it still might get rejected. It's not really fair to the authors. And so many journals will actually explicitly say, look, if there are more than 3 or 4 major things wrong with the paper, you should just reject it and not sort of give them false hope that they should invest all this time and effort and maybe should send it elsewhere. Those are probably the biggest thing. I think for me, it's original. It's not necessarily originality, but importance and internal validity are things that trip people, that in my mind are often the most important reasons to reject for me. Okay, and then advice on writing reviews, and maybe I'll come back to that when we talk about this paper, and maybe I'll summarize, what I would say as a reviewer when we talk about this bioRxiv paper that we sent around. Okay. But what I will say is that everyone has a different style. I try not to be super nitpicky. So one style I see is that some reviewers will break down a paper figure by figure, sub-figure by sub, and they'll say figure 1A, this is blah, 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 I gotta fix this, and figure 1B gotta fix that, figure 1C will fix that. I don't generally do that. What I will do is that I will look at the claims, okay? So I will say the authors are saying this, and my review kind of focused on, is there something really important about how the paper is done that makes me not believe this claim, that you adequately found evidence for it? And if so, what do I think you'd have to show me to make me believe that this is valid? Does that make sense? So I come in at really from a claims-based review process. That's how I would do it. But you will see different styles. I tend not to be the kind of person, like I said, who picks at individual elements of figures if they don't necessarily fit into a larger picture of what the authors are trying to tell us. Okay, these are great questions, but maybe more will become clear as we kind of go through this paper. Is that okay? All right, so I am going to share this paper, and I totally understand if you haven't really had time to read it up until now. I get it. You're all very busy, but I'll kind of walk us through the highlights and kind of like what I thought. So I'll talk about this from a reviewer's lens, right? How would I review this paper? So, all right. So this is a paper on sex differences in clinical findings on patients with COVID-19. And so, okay, that's a title. And then we go right to the abstract, right? And so again, my goal is to figure out, well, what are the authors trying to do in this study? And so they tell us that they're really kind of looking at differences in outcomes among patients with COVID-19 by sex, okay? And here they briefly talk about how they did this. So this is a retrospective study of 47 patients from this time period. And they have these basic, demographic and lab data comparing men and women. And so I looked at the results, and I really skimmed this. I don't really pay a lot of attention to this right here. I really am just trying to figure out what are they trying to do. And so I can see here that they're going to make a number of claims about differences between men and women who have COVID-19. That's all I'm going to take away from this for now. And then I will look at the conclusion, and this is their claim, right? So their claim is that there may be differences in COVID outcome based on sex. And they're saying here that men are likely to have a more complicated clinical course compared to women. And so this is what I'm going to judge them on. Okay. Do they provide enough evidence in this paper so that I believe this at the end of all this? Okay. And again, stop me if you have any questions about as we go. And I have the chat open. Okay. So the intro, again, I'd really just sort of, if I know this field, I don't have to spend a lot of time on it. If I don't, then it's helpful for me to kind of understand the background. But I don't think this requires a lot of introduction. We all know about COVID-19, and we all kind of know that's a serious problem, and we know a little bit about the nomenclature, and it spread quickly through China and other countries, and lots of people had it, and some people did really poorly. And so that's really the introduction in a nutshell. And then some data about clinical characteristics. And at least at the time that this was published, this was back in February 2020. So remember, this was like, as we were just starting to learn about COVID, and it had not really hit the US in a way that we recognize yet. We didn't have a lot of data on patients with severe disease, right? And so this is what they're trying to do. Okay, so as I said before, now I kind of know what they're trying to do. I kind of know what their major claim, which is that they're gender related or sex related differences in outcomes. So how do they do this? This is the methods. And this is where I will spend a lot of time trying to make sure I understand how they did it. And are there kind of critical problems with how it was done? All right. So again, it's a retrospective data study, single center. Okay. So one hospital of 47 patients, so relatively small. And so already you can see that there are some inherent limitations to the study in the fact that it's A, retrospective, B, single site, and C, kind of small sample size. Okay. And then they were all diagnosed with COVID-19, and we'll see next how they actually did that. And they classified them as having severe pneumonia. And so they're following some standard definitions, which is good, right? So I think part of my process here is, are they using standard definitions for their outcomes and their exposures? And if not, then we need to understand why they're deviating from what's commonly accepted. But at least this passes smell test, okay? So it sounds like they're using commonly accepted definitions. And then they confirmed infection, and they said that they did in 4 different institutions. They got throat swabs, and then they extracted RNA. So this is like a PCR-based assay. So that sounds good, right? So I'll take their word for it that they use a highly sensitive and specific assay to make the diagnosis of COVID-19. So this isn't some kind of misclassification error that might happen if you used a bad test, and that often then might call into question whether or not you had a significant number of patients who actually didn't have COVID-19, right? So that's important. So, okay, so I believe that. I think that sounds reasonable. They tested for other viruses, and I think that's an important point. So they kind of confirmed that they didn't have other infections that might mimic COVID-19. So that's important. And then they look for other bacterial and fungal infections, and they also list their criteria for severe pneumonia. So all this part is good to me. All right. So then data collection, right? So what did they collect? How did they do it? And fairly standard lab tests. They mentioned when they did them. They mentioned the tests they did. I guess if I were a super expert in the field and it mattered, to be honest, I don't really know, but maybe IL-6 assays, these aren't standard clinical assays. Maybe it matters which assay they use, right? If this is an ELISA, which kit, those kinds of things. But I think for the purpose of this manuscript, they didn't really make any big claims about IL-6. And so maybe we'll leave that alone. So statistical analysis, they kind of talk about how they did it. They use a Mann-Whitney U, which is better, in some ways better than a t-test. But they talk about this, and we'll talk about sort of a statistical pitfall as we go into the tables where they don't really talk about it here. And it's not really obvious what the pitfall is when you just look at this, but it kind of passes sort of the smell test. It's a 2-sided test. They have a pretty standard p-value cutoff of 0.05. these sound like they're, fairly reasonable from the get-go. Okay, so I think we looked at several kind of limitations of the methodology, but now we go into results, and now we're kind of gonna dig into to whether I believe what they found. Okay, so again, relatively small numbers. 60% were men, and so this is really now where we kind of get into some of what I think are the more significant problems in the paper. They have a pretty standard table one, and so these are in many clinical papers. This kind of presents the basic clinical characteristics of their study population. So they look at men, they have women, not that many women, not that many men. And they point out that that history of COPD was non-significantly higher in men. And so I guess what I would say to you right now is, what do you make of that? Maybe any comments about this? So I think they're making the claim that, okay, there's some differences between men and women, but they're not significant. Okay, maybe there's more COPD, but they're trying to show us all these data show that there aren't that many significant differences. There's a difference in oxygen saturation and presentation. But what do you make of this specifically? And they're saying it's not significant. So this is where I would have a problem here, in that, okay, so first of all, these aren't big numbers, right? So maybe this is just underpowered, right? So 0.052, but a quarter of them have COPD in men and none of them in women. So that's kind of important. That's a big difference, because we know that underlying lung disease is associated with poor outcome in COVID-19, right? So that's kind of important. And then the second thing, which they don't really say here at all, but what is the major risk factor for COPD? Smoking, right. So, and so we know nothing about smoking status here, right? And that's really important, because if pretty much everyone with COPD is a smoker, it's unusual for non-smokers to have COPD. And so I would really want to know, like, what were smoking rates in these two populations, first of all, okay? So it turned out that men, if it turned out that 3/4 of men were smokers and maybe 1/3 of women were smokers, what kind of bias is that? What would we call that, do you know, as a bias or a systematic problem? Yeah, it's a confounder. Good, it's a confounder. So this is a very common problem in retrospective clinical studies, is confounding. And what confounding really is that there is a third variable that's associated with both the exposure and the outcome. Okay, so it may seem that being male is associated with the outcome of bad, severe COVID-19, when in reality, being male is in fact associated with smoking, and it's actually a smoking history, which is the true association with COVID-19. Does that make sense? So I think confounding is super, super important. And so when you look at these papers, you want to ask yourself, because there's the potential for confounding. Now, there are ways to try to control for it. And so, for example, they might have had enough patients to be able to match patients or stratify them by smoking status. So let's say they had actually 400 men, 400 women, and they could then try to either match them by smoking status or stratify the analysis by smoking status, yes or no, or try to correct for it after the fact by, for example, multiple logistic regression, or there are other ways you can try to correct for this after the fact. But at the end of the day, every retrospective study you can think of, there is always the risk for confounding, okay? That the two populations are somehow different because of the presence of a third variable that we're missing. So how many of you are kind of familiar with the sort of now infamous hormone replacement therapy studies back in the 90s and 80s? Does that ring a bell to anyone? So there is this famous cohort of nurses in Boston that have been followed for decades, called the Nurses Health Study. And there was, and this is sort of what people found using this data set was that women who were on hormone replacement therapy were less likely to have cardiovascular disease. It was protective. Okay, that was the conclusion from the study. However, randomized controlled trials found this to actually be not true. In fact, it was the opposite. That HRT actually was actually bad for you in terms of cardiovascular disease. And what we think actually happened was that there was confounding, which that women who are on HRT were more likely to be of higher socioeconomic status, more likely to be and so kind of more generally health aware, and had a variety of other healthy habits that women who weren't HRT did not have. Okay, so always think of confounding. I think that's super important. So this jumped out at me as being something where this was very concerning, as there's potential for confounding, and how can we fix that? The second issue with this, and I should have gone back to this in the methods, but what is the study population? So the study population really is, or the sample is really people who are hospitalized with COVID-19, right? But can you think of reasons why there might be something called selection bias here? And so we talked about confounding, but selection bias is also really important. And so selection bias really refers to, is there some systematic way by which this study sample is systematically different from the population being all men and all women. Okay, so really what they're trying to say is we're going to study all women with COVID-19 and all men with COVID-19. In order to do this, though, we're analyzing a sample of men with COVID-19 and a sample of women with COVID-19. All right, so in selection bias, the sample that you're studying is somehow systematically not like the population of all men or all women. And can someone kind of point out where the selection bias here could potentially arise in any kind of hospital-based study?
Some things that sort of just like pop into my mind are like, who is likely to actually go to the hospital?
Yes.
Are they likely to go to that particular hospital versus
Perfect. So could there be some systematic differences between men and women in their likelihood to go to the hospital at the symptoms of COVID-19? Okay. And you could imagine how that could be quite possible, right? So it's possible that maybe, I'm just making this up, okay, but maybe a younger woman with a family is less likely to leave her kids and go to the hospital with COVID-19 and more likely to stick it at home, okay, for example. Or you could argue the opposite case, that a man is less likely to go to the hospital because maybe they're more likely to be the one earning salary for the family, and therefore they don't want to take time off work. So you could cut a number of ways, but you can imagine why there could be a selection bias happening here. So selection bias is a really important bias to think about, especially the kinds of things that you're going to see at MJM, which I can imagine that lots of papers are going to be related to. We studied patients at Michigan Medicine or Ohio State University or some other local healthcare system, and were they selected from the clinics? All right, so were they approaching the clinics? And who says yes to a med student who will approach them to do a study, right? And so maybe they're different from people who didn't participate in the study. Or maybe an example I mentioned earlier, in an emailed survey, who responds to a survey, right? You respond to a survey because maybe you have some axe to grind about something, or you're somehow different from the people who did not respond. So that is another critical source of bias that I think you have to really carefully think about. So here, I would say that there is a strong possibility of a selection bias by this. Now, does it invalidate the study? No, because this limits the generalizability, right? You might not be able to say much about all men and all women, but you might be able to say something about hospitalized men and hospitalized women in this hospital with COVID-19, okay? But just be aware of the limitations that it draws around this. Okay, so good. So we have the methods, we have the first table, this possibility of confounding, which I mentioned here. And then they have all these different things. And again, usually this table 1 is trying to convince you that their populations aren't so different at baseline that they can't be compared. Okay. And then in table 2, now they have all these different tests. So they have the white blood count, and they have like this procalcitonin, and they have IL-6, and they have all these other things, right? And so now they're trying to make the claim that maybe that men have much higher levels of N-terminal pro-BNP than women. Okay, and this is statistically significant at a significance level of 0.05 by Whitney Yu. All right. And I know this is one of those terrible guess what I'm thinking kind of questions, but what's wrong with this analysis? What's wrong with this? What's wrong with the p-value that they calculated and they're saying, oh, this is significant. Look at this p-value of 0.023. And this is something you'll see over and over and over again. So does it matter that they've done basically what 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, that we're probably getting up to 20 different tests in the table? Does that matter, and why does that matter? For a purpose of, yeah, go ahead.
If you're testing for, you know, all these different factors, there's a higher, each test you add, there's a higher chance you're going to get a positive, a significant p-value just based on chance.
Exactly. Right. So this is the multiple comparisons problem, right? And so, you know, if you flip a coin or if you roll a 20-sided dice like 20 times, right? Just out of chance, you're very likely to have roll a 1 once, right? And that's our P of 0.05. And so in anything like this where you see many independent comparisons, it's actually not valid to pick a P of 0.05 as your cutoff, because it's actually quite possible that this is entirely chance. Okay. And so there are ways around this. For example, the most stringent way of doing this is a correction where you divide your 0.05 by the number of tests you're doing. And so this would be, you know, you'd have to get to like 0.0025, let's say, to be significant. And that's a pretty, you know, rigorous way of doing it, but there are other ways. And so just to point out to you that you'll see this over and over again. And so I don't know if this is significant because you've done so many different tests, this could just have arisen by chance, especially when you're kind of flirting with 0.05, okay? And you'll see many papers where it's kind of 0.043 and you're like, oh, it's significant. And you have to wonder whether it really is or isn't, okay? Also, I think it's important to recognize that there's a difference between statistical significance and biological significance, okay? And so it can sometimes be the case where something is statistically significant, but by virtue of having a large sample, that you're really saying, oh, is the difference of this test being 100 versus 93, does that really matter? Is that really biologically significant? And sometimes you have to sort of put on that hat in terms of thinking about understanding the clinical or biological relevance of that result, okay? Because maybe it's statistically significant, but maybe it's not biologically relevant. Or maybe a study that says, oh, you know, take this new antihypertensive drug and you'll lower your systolic blood pressure by 4 millimeters of mercury, and that's significant. And you get to ask yourself, well, is that biologically relevant or not, okay? In terms of outcomes like reducing the risk of stroke and heart attack and death, for example. Okay. And then some more, you know, tables on who got antiviral therapy. They're not, you know, you could sort of argue about, well, they're not really telling you what antiviral therapies. There's probably some heterogeneity here. It probably does matter. More men got antibiotics. Maybe that's bad. Maybe that accounts for, maybe it tells you that the reason men do worse, that maybe more of them had bacterial infection than women, for example. Okay. Maybe that's the reason why they did more poorly is the presence of additional infections and not COVID-19 itself. Okay. And then, so we get to the discussion now, and they kind of rehash a little bit here, but then I think this is good. And so they kind of put it into context. And so they point out that, okay, they've also found, there are other papers that have found that there are sex associations with outcome in COVID, and they kind of talk about some of these other papers in literature, and they don't really talk about maybe how their paper is different. but they talk about mechanisms. I think it's fine to speculate a little bit in discussion. I think that's what it's for. You could come up with some ideas to explain why you found what we found. And they do talk about bacterial infection. I think that's important. They talk about like why there was more positive tests for flu in men and women, and so I think that's important too. And I think they also talk about limitations, so that's important too. And I mentioned that as something that I think should be in every paper about how is it limited. So they do kind of talk about confounders and selection. But I think they're being very generic about it. I think, they could probably do a better job of explicitly spelling out what they are for the reader. And so if I were reviewing this, I would kind of point that out. And then I think we didn't talk about this, but they really have a very, very short follow-up time. And so, I think it's on the order of like days or weeks after diagnosis, and maybe it'd be also helpful to know what happened a month out or 3 months out as in terms of outcomes. And then we have our conclusions, and then we have our references. And again, this is where, if there was something really critical to their methodology or to their premise, I might check out, what that actually said. Okay. So coming back to my review hat, I would say as a reviewer, I'd say the premise and the importance I think are clear. So COVID obviously is a serious thing, especially back in February 2020. We knew very little about it, so it would make a lot of sense to study sex differences in COVID outcomes. So I think the premise is sound. And then I would say that in terms of their author's central claim that there are sex differences, I would say that I would have some important concerns about, first of all, the potential for selection bias, and maybe even more importantly, the potential for confounding because of this higher rates of COPD in men. We have no information about their smoking status. You can imagine all kinds of other confounders that are lacking here. We know nothing about socioeconomic status. We know nothing about alcohol use. We know nothing about things that potentially I'm trying to remember here in terms of what else they showed us. I think they showed us things like, now we know, but we know nothing about BMI, right? So we know nothing about BMI, and so those are things that are lacking. And so I would kind of list those as major criticisms. And honestly, I would probably reject this for most journals simply based on to me, the very high risk of confounding. And I think the difficulty in easily fixing that based on the study on data they're showing me, coupled with this small sample size, retrospective nature, and then potentially some issues with selection bias, although I think that's not in itself a deal breaker. Yeah. Any other comments or questions or things that other people might have picked out?
I just this was like a more minor point with this paper, but I think this is a question that has come up for when reviewing other manuscripts. If there are grammatical errors or like spelling errors based on the order of magnitude, how do you go about bringing that up as a reviewer?
Yeah, and especially I don't know. This especially is something that we see, especially from authors from other countries, right? So understandable if English is not their first language, you understand how there can be things like that, and so sometimes easy out for us is that a paper like this from China, for example, we simply ask that it be read by a native English speaker for style and grammar and spelling for a revised manuscript. But I would say, for what you're seeing, I would list specific examples. So something is really poorly worded, really unclear wording, I would literally provide quotes from the text, or say, line number, whatever, and provide the quote and say, for example, this is confusing and needs to be rewritten. And so I'm not going to go correct every single typo I find. But if there's statements that are confusing to me or could be misinterpreted, I think those are important to point out, so that you remove that ambiguity from the manuscript. Yeah. And those could be minor comments, right? Because those are not going to be things that make or break the quality of the study, but are things I think are worth correcting before acceptance. So in general, again, like if I thought of either one fatal flaw or I had too many, meaning let's say more than 3 major criticisms to fix, for most journals, I would recommend rejection. Now, of course, as the editors, editors have a lot of leeway. So it's not uncommon for me as an editor to get back reviews, and two reviewers will say accept revisions, one will say reject. And I as editor have to read those reviews and kind of integrate them and ask, well, did the person saying reject really find something that was really, critically flawed with the paper, and I'm going to go along with the reject, or do I go along with the 2 other reviewers? And so this is where editorial judgment, I think, is also really important too. So as a reviewer, I just recommend, but it's really up to editors. The final thing I would say, and I forgot to mention this, in my review, I never say in my review where the paper should be accepted or rejected in the review itself. And so usually when I submit a review to a journal, there's a separate area for me to give my recommendation to the editors. But the author should never see what I recommend, because it's not my job to decide for the journal if something should be rejected. This is my recommendation to editors, if that makes sense. Okay, so in the text of my review, I will never talk about this should be rejected because, or this should be accepted because. I let the editors make that decision, but I'll make my recommendations to editors. And for many journals, and I don't know if this is true of MJM, maybe you can fill us in on this. There is a separate place for me to send confidential comments to editors. So I'll have the review that the authors will see, but also might make comments about the paper to editors, especially if there is, if I have strong feelings about something, either positive or negative. Like I might say, look, there's some significant problems, but I think this is an important study, and I think they should be given a chance to revise this paper, or something like that. And as you write a review, I think I don't spend a lot of time summarizing the paper itself. I think sometimes people spend a lot of time like recapping what the manuscript said. You don't have to do that. I think you can probably safely do that in 3 or 4 sentences about kind of the key points about the manuscript, what they're trying to do, so I will kind of recap the key points of the article, and then I will say 1 or 2 sentences about why I think the paper is important, okay, for the editors, because again, the editors often know even less about the field than I do, right? And so I might try to put in context for the editors. I might say, this paper is potentially really important because this thing is not known, or there's a controversy in the field that this paper is going to help, address. So I do probably a statement or 2 of importance in my first paragraph, and then I go into my major comments, and then I'll finish off with some minors. But I tend not to write super long reviews. Usually, for most papers, it could fit on 1 single space page.
Since a lot of our reviewers will probably be reviewing something out of their comfort zone, I know you touched upon this a little bit earlier, but sort of getting back to the impact of things, when you sort of dip into the literature to look at that impact for an area that you're not really comfortable with, do you have a place that you usually like to start, or do you have like a sort of way that you like to go through that?
Yeah, right. So what I usually will do if I'm not super familiar with field is I'll go straight to PubMed. I'll just go straight to PubMed and pop in search terms. And so, for example, for this one, it'd be COVID-19 sex outcome, right? And by this point, it'll probably be like 1,000 papers, but I'll kind of quickly skim them, the titles, and get a sense for, am I seeing lots and lots of similar titles? And then I might I'll look at the journal. And so obviously, a paper published in the BMJ or JAMA is going to carry more weight than a paper in a very obscure small journal. So I might look at kind of those those bigger kind of publications to get a sense for what has been done in that area. If I'm really not finding anything, that's a good sign, I guess, right? I'm really not able to find many papers that have to do with this area, then it's got to be something that has not been extensively looked at. So I will always, unless it's something that I know intimately well, kind of do a search in PubMed, and that might take me 5 to 15 minutes to kind of get a sense for what's out there. So once I've sort of got just a general gestalt in terms of many papers in this area or not many papers in the area, then I might look at a few. And if I can find a very recent review in the field, I'll try to look at that and sort of see, okay, kind of what's the state of the art in this particular niche or topic that's known. Reviews often will talk about what's not known or areas of further study that are needed. And so I'll look at that as well. But if there really aren't any, then I'll kind of look at maybe 2 or 3 related papers in the area, kind of get a sense for, again, sort of importance to the field, its context. I might also get a sense for like, what were the methodologies that were generally used? And so if this is a paper that's based on analysis of a Medicare claims database, right, then I'll want to know, okay, have people done analysis on a similar database, or are they using different databases? And so maybe this is important because now we're extending this to a different administrative data set, for example. So that might be a little bit more nuanced than what you're getting at, but that's kind of how I would approach it. I will go right to PubMed and look around a little bit, and you will get better at it. I think what's really good for you as you practice doing as reviewers, that it will immensely make you better at searching for things in the medical literature, and that's a good thing.
And then I did have one other question. I know this is like a huge whole separate discussion, but briefly touching on what are sort of like some red flags that you look out for like major ethical issues with the paper, and how do you go about addressing those?
Yeah. Well, that's a good question. I mean, we generally take on face value that they have IRB approval to do the work, right? So I do look out for, if it's a clinical study, do they get IRB approval? Sometimes if you really have real questions, you can ask for it. You can, as the reviewer, you can ask that the authors provide their approved IRB protocol. And so especially if you think that the study was conducted in a way that really doesn't seem right to you, I think it's within your purview to ask for that. And I've definitely seen, as an editor, cases where reviewers ask for that. And so that's one area. I think another area is sort of potential for data falsification, or you're really worried that maybe there's potential for fraud, or in the basic sciences, is this Western blot kind of, do I worry that maybe it's been retouched or something? I think that's where you have to be very careful. And I think that's where you should refer that directly to the editors. So as a reviewer, I will never say in my review that I think this was falsified data, but I will go to editors and say, look, I'm really concerned about this figure because of X, Y, or Z. What do you think? So I'll kind of bump it up the ladder very early. But that's another area of do you think there's potential for data misuse or falsification, which is a whole nother area. Are there other scenarios, Morgan, that you were thinking of that I didn't address?
Those are the 2 main ones.
Okay. I have to say, what I heard of the introduction is really great, and that as reviewers, really look to your editors as helping, as there to help you, and don't feel like you're on an island as far as your review goes. There are some journals that actually encourage reviewers to actually kind of share their views with these other as a kind of craft. So in particular, there's a journal called eLife in the basic sciences, and their model is actually very interesting, where they actually have the editor and the reviewers sit down and share their independent reviews, and they craft a single review summary for the authors, because where they really hash out, they have to agree upon what did they see as the things that have to be addressed before a paper is suitable for publication. Because sometimes as an author, sometimes what I get are 3 reviews, and they have 4 different things, but they're all different. So it becomes like 12 different things I had to respond to before the paper can be accepted. That can be frustrating too, if the reviewers have very different ideas of what needs to be fixed. And so I think in the process that you have for MJM, I think there's a potential for you to sit down as a group of reviewers and with editors say, look, what's our consensus on this manuscript potentially? And I think that can be a very valuable part of the process too.
Does anyone else have any other questions? All right, well, I want to thank Dr. Tai for spending his evening with us. This was incredibly helpful for all of us. We very much appreciate your time, and I want to say thank you for taking us through this manuscript and how to review the paper.
Yeah, you're welcome. Thanks again for the invite. Good luck with the upcoming issue.
Thank you.
Yeah.
Thank
Bye.
you. Thank you.
Thanks.
All right, everyone, have a good evening.